Hello everyone and welcome to the Navin Times Talk from the Heart. The hand that rocks the cradle rules the world. However, women have many issues that they are facing today. From puberty to menstrual cycles, to pregnancy, to childbirth, and the entire gamut of conditions that they have to face. They have a lot on their plate. And today, with cervical cancer, breast cancer on the rise, the issues that women have to face are huge, very, very serious. Our guest today is an obstetrician, a gynecologist, an IVF specialist. His resume is really long and very impressive. I am just going to highlight a few and I hope I don't make mistakes. He is an MBBS from GMC and a gold medalist for that. He is an MD in obstetrics and gynecology. He conceptualized One World in December 1979 for unification of world and believes that all life is one, that all countries should merge into one world. He has published a book as well on One World Without Borders. He has treated over 30,000 patients of infertility in the last 26 years and with over 9,000 pregnancies. He has delivered more than 300 IVF babies. He has given talks and lectures all over India. He has published research papers in India as well as abroad, and at present he is working as the director of Dr. Kedar's Hospital and IVF and CSI Center, beg your pardon, since 1987 to date, of course. I'm really happy to introduce you to Dr. Kedar Padte. Dr. Kedar, hello, and thank you for coming on our show.
Thank you, Maria, very much for inviting me, and the Navin Times for having me here today. Thank you so much. Today is also the World IVF Day, the day on which the first IVF baby, Lucy Brown, was born.
All right.
And so it even makes it more special for me since I'm in this field.
Right. So, since you have told us about the IVF baby, where was the first IVF baby born, doctor?
It was born in England, and Edward and Steptoe were the two scientists, and they really struggled very hard. And after perhaps more than 100 efforts, they managed to get the first successful baby, which was Lucy Brown. And now she will be, I think, about 43-year-old, and she also herself has a baby, which is not an IVF baby.
Okay.
So that's a delightful.
I know, that is such a great accomplishment. So when was the first IVF baby born in Goa?
It was way back in 2001. That baby is now almost 20 years.
Wow.
And since then, we have more than 2,500 IVF babies born with us at our center. So it's been 2 decades now.
Of course, a great accomplishment. Like I said, the resume is so impressive. There was so much more. I've condensed it to like 2%. So you can imagine what an impressive resume doctor has. Doctor, you know, the first question that I think is very important, and most people wonder, like I have a daughter, and women who have daughters, the first question that you normally think about is, when is the right time to take my daughter to a gynec? What is the earliest? Because very confusing. Normally, in my days, it was like when you're pregnant, right? That was the only time you go to a gynec. So when is the right time, according to you, of course?
Nadia, there is no specific right time. Generally, nowadays, girls start menstruating at about 9, 10, and 11 years, and most of them start menstruating by 12. Like earlier, the puberty would appear at around 13 to 14. Once they start menstruating, they will have certain amount of pain during periods, which is also normal. So if she's a normal, healthy young girl with no health issues, there is no need to visit a gynec way up to her age of 17 or 18, or even after that, because if there is no problem at all, there is no need to visit. So there is no specific age at which you must visit a gynec as such.
Okay, because you know the first I remember when I went to for a gynec visit, this was way back, I think it must have been 16 or 17, it was for an infection. And the moment you sleep on that table, the fear that you feel is unbelievable, you know. I mean, young girls, the moment you tell them you have to go to a gynec, I remember my daughter said, she started crying. She was like, no, I'm not going. I mean, that fear is there. But
yes, obviously, because if you're going to a gynec and if you're going to get examined and a girl is not married, then she is going to feel the fear that she is going to be examined. That itself is enough to cause sufficient paranoia. So there is no reason to visit. Even your GP can do the job of treating some local infections, like fungal infections are pretty common, and discharges which are pretty common, and they don't need to be intervened by any checkups at all. Do that. Start with grandmother's remedies and manage with a GP. But if there is a significant symptom which needs to be addressed by a gynecologist, then of course do visit. And in that case, do counsel your daughter that, see, a gynecologist is not a terror. He will only do you
that
good.
Was the doctor, that was years ago. So yes, I understand what you're saying.
And believe me, you nowadays, unmarried girls walk into the clinic with their boyfriends or alone and are very bold. And they express their issues, because now there are a series of issues which have come up because of the variations, the fast life and the modernization which has happened. And so they do visit a gynecologist on their own and sometimes with their parents.
You know, the first thing that you spoke about is that girls today are menstruating earlier. I know of so many cases. I think the youngest one I know of was 8.5 years old. She started menstruating at 8.5, and I was absolutely shocked, because you know, for me menstruation starts 13, 14, but today, like you rightly said, menstruation is starting early. Why, doctor? What is causing it?
This is related to the external stimulus. See, when a child is growing, her reproductive organs are kept under check by hormones which are secreted by a gland called the pineal gland. And this is controlling her onset. As she grows and she becomes mature, she starts understanding sexuality when the inhibitory effect of the pineal gland goes off, and then she starts menstruating. However, today's girls, there are a lot of changes which have happened. One is their exercise schedules are very poor. If you ask me, 70% girls don't exercise.
True.
The diets are also a part of it. That means they have high calorie diet and junk food. 3, they are exposed to a lot of sexual pictures, whether it is media, magazine, television, internet, what have you. And so they see sexuality much earlier in their life, and so their maturity comes in early, and girls start menstruating at 8.5 and 9. I have parents who come and complain that my daughter is already 10.5 and she is not menstruating. All her friends have already started menstruating at 9.5. But when it happens at home and it happens early, like around 8, you do start getting a bit apprehensive.
Very.
Because the girl is only in the 4th standard and she starts menstruating. And she probably does not understand what is happening.
True.
So this is a trend which has happened, and it is going to stay.
Right. You know, like you said, when children are so young, when girls are so young and they start menstruating, it is very scary for the parents, because parents don't know how that child is going to manage with a sanitary napkin and changing and things like that. You also said just now that that they are exposed to a lot of sexuality on media. So does this activate something in the pineal gland?
It takes away the inhibitory effect of the pineal gland. The FSH and the LH hormones which come from the pituitary gland start coming much earlier, and so the ovary starts functioning a bit early, and she starts developing a breast bud and the pubic hair or the axillary hair, and she becomes mature a bit early. So that's called pubarchy and thelarchy. Thelarchy means the maturation of the breast. Pubarchy is appearance of the breast, of the hair around the pubic area, and then of course menarche, which is menstruation starts.
Right. So is it, I'm putting you in the spot now, is menstruating early a good thing or a bad thing?
It's nothing to do with good or bad. It is constitutional, and so there is nothing bad about it from the point of view of the physique of the child. If she is constitutionally normal, it's fine. It may be bad in the sense from her point of view and from the family point of view. She started menstruating early, she has to start using sanitary pads, it's a monthly painful process. So from that point of view, if it happens 2-3 years earlier, naturally it's going to produce a lot of apprehension and sanitary measures. It takes away some vital days from her life when she cannot go out and play probably, or swim or be athletic. 2 or 3 days every month is a lot of time. So in that way, it is a bit of a negative.
And even psychologically, like if I am 9 and have started menstruating, I'm playing with my friends and I'm so worried all the time that I'm going to stain my clothes. What if people come to know? What if my friends come to know? I mean, isn't there a psychological aspect to this as well?
Individually, it depends on differs from girl to girl. There are some girls who are very apprehensive about it and they would remain shy and remain indoor and or not mix, versus other girls who are pretty open about it and they say, okay, this is it, we have learned to live with it and it's going to be there. So you have to counsel them, coach them to understand that this is a lifetime process and it's going to stay, and it's not a taboo, or don't get any negatives out of it. Just learn to deal with it.
Right. You also spoke about menstrual pain. Is that common, or when does it become a worrying issue? When is it that, you know, a girl or a woman has to go and check it out because the pain is not, you know, not good, or it is something that you need to look into? When would you say?
Yeah, Maria. So let's look at it like this. Let's look at about 10 girls who have menstruation and they have pain.
Right.
There will be quite a few who get menses and they do not get pain. So they are on the other side of the curtain. Those who do get pain, almost 70% of them, in 7 out of 10, will have mild pain and they can do away with a hot water bag and a little bit of a rest on first and second day. And within 1.5 to 2 days, they are back to normal. The other 2 will require painkiller, and this painkiller will be required every month. So there's an antispasmodic with a painkiller, which is like a paracetamol or a mefenamic acid. You must have heard household names like Meftal-Spas or Parma-Spas, etc.
I used to take that all the time.
Yes,
oh my
and
God.
some people take cyclopumps and what have
Yes.
you. That takes care of the other 2. The last one is severe incapacitating dysmenorrhea, as it is called, which is very, very severe, and they get nausea, vomiting, headache, and even blackouts. Now that needs to be addressed very carefully, and this is when you need to get to a gynecologist and get an opinion.
So why does this happen to some girls? What is it that is making it so bad for them, doctor?
Okay, that's a whole chapter in itself. But
okay,
to put
but
it
very
short,
please,
yeah, to make it very
not
short,
technical,
yes.
but just a few. You
so
know.
when the period starts, the endometrium is shed off, and it's
That
in the
is the
form
lining of the-
lining. And
right.
if it is big and the opening is very small, the cervical opening, the uterus contracts very hard to push it out until the cast comes out. She feels that pain. It's like a labor pain and can be very, very severe. But there can be other issues which can be there, like endometriosis, which is also seen in younger girls, and that may be the cause of pain and or some cyst or other pathologist, and of course the pain threshold. So all these things have to be looked into and then treated.
What about clotting? There are some girls, some women, I know women as well, who have very, very heavy clotting. You know, they are so frightened to even sit because it's like, I'm going to mess my clothes up. You know, so
anything which is clotting, which is as bad as you are talking about, has to be addressed carefully, and especially if it's in ladies, then we may be dealing with either an abnormal uterine bleeding due to hormonal imbalance. It may be a fibroid, it may be adenomyosis, or any other reason why this is happening. It has to be investigated and treated accordingly.
Okay, so but are there any household remedies? Because with everyone becoming, you know, very conscious about the medication they are taking, what about household remedies besides hot water bag? Is there anything else? I know my mom used to give me ajwain water.
Yes.
That was one thing that, you know, used to give a little bit of relief, not entirely. So is there any household remedies that we can use?
Maria, besides hot water bag and ajwain water, I really don't know, but one should ask the grandmother, and she would have some similar remedies ranging from various types of concoctions to teas and
yes,
other things which probably help relief. I don't know how much of it is psychological and how much of it is real, but you tide over a period of time that you take this and you're now going to feel better, and once the clot passes off in a small girl, she starts feeling better. But that's a good way of handling it rather than take painkillers every time.
True.
So
absolutely. Yes.
Best
yes.
grandmothers,
True.
as
true.
long as it is not incapacitated.
I know. That is the important, that's the criteria where, you know, okay, after beyond this I need to go and take some medication. Now you spoke about, you know, today there are a lot of issues that women, I spoke about it in the introduction as well, there are a lot of issues that women are facing. I mean, cancers are, of course, at the, you know, end of it, but from the menstrual pain and labor pain, what else, which other conditions today are becoming more common?
Yeah. One of them is infections. Vaginal urinary infections as well as pelvic infection is becoming very common. There are various reasons for that. One is promiscuous behavior, wherein girls will indulge in sexual activity much before they are married. There is nothing to malign this thing. It is okay. I mean, it is up to the girl to decide. But then it results in infections, and sometimes it can even be a sexually transmitted disease. So these are the other things which are coming up. The second thing which is coming up, which is commonly seen in girls, is premenstrual syndrome, in which they become very irritable, very angry, and psychologically disturbed and depressed. So this is the other issue which is coming up. As you grow older and after marriage, issues of fibroids, endometriosis, excessive bleeding, these are the other issues which are now coming up very powerfully. Every delivered woman should at some point of time go through a test which is called pap smear, as cervical cancer is one of the commonest cancers, besides going through a breast examination, and if required a mammogram, to prevent a breast cancer and or detect it pretty early so that it can be handled much earlier. So these are the issues which are coming up. The other issues which are coming up are premenopausal and menopausal, wherein again, due to the hormonal changes which are happening, the estrogen and progesterone which is going down, the FSH and LH which is increasing, hot flashes, sweating, mood changes are the issues which are coming up very much. Not that they were not there when our grandmothers had this, but there is a lot of awareness about it, and the social, economic and household pressures as well as educating the children is so much that the state of mind is already a bit on a hyper state, and then hormonal changes
then you add
trigger.
to this, right?
So these are the changes which are coming up.
But you spoke about menopause, doctor, and you spoke about some of the symptoms of menopause. You said this is it, the hot flushes and the mood swings. What is the average age for an Indian woman to have her menopause? Like, it varies, of course. I'm just talking about the average age. What is it?
In as much as the average age of puberty was 14 to 15, as we know, and now it has come down to 10, 12, and even 9.5 to 10. The menopausal age has got delayed. Earlier, we were okay with menopause starting at 42, 44, 45, but now we find many women menstruating at 48, 49, 50, and even 51, 52. I still have some patients who are menstruating at 54. But if they are healthy, fine and normal, their pap smear is normal and the uterus is fine, that's it. She is constitutionally placed like that. But if you want to ask me, then the average age now is between 47 to 50 years.
And if the woman goes beyond 50 and she is healthy, you said it's fine. Doctor has said that it is fine even after 50. If you're still menstruating, it is fine. So which is the age then I should start worrying if I'm still menstruating? Suppose I'm 55 and I'm menstruating.
You visit
still.
your gynec very regularly, every 6 months maybe. Get an examination done, do a sonography. If it's a cyclical bleed, which means a normal menses,
28, 30 days. Okay.
Nothing to worry. It will eventually stop. It's not that it's going to go on up to 60 or 65. If it is irregular, if it is excessive flow, if there is some pain, foul smelling discharge, then you are dealing with something which is other than the normal menses, and that needs to be addressed.
Okay. Now, menopause starts for some women, it starts from 40. Am I right? Yes. So some of the symptoms you've already told us. So do these symptoms go on till they stop completely menstruating, or it's just there for some time and then it just goes off? How does it work, doctor?
It varies from person to person, lady to lady. So some will have some perimenopausal symptoms which last for about 6 months to 1 year, and they are out with it. There are some in whom it will last for about 2 years. I have not seen many perimenopausal symptoms lasting beyond 2 to 2.5 years, though some will get it right from the age of 45 up to the age of 50, and it can be very disturbing.
It is. I started around about 40, and it was terrible, because I would sit in an AC room, and even with the AC on, I would be sweating.
Yes.
I would be sweating so much, and knowing that I'm sweating so much, it used to irritate me. And I know there are women out there who face this problem.
Absolutely.
It's like, oh my God, what do I do? What do I do?
It's called hot flashes, and it happens because of the variation. The temperature regulation system in our brainstem is very closely related to this area which secretes FSH and LH. So when the estrogen and progesterone fall during menopause, the brain thinks that it's time to produce more FSH and LH. So the normal FSH and LH level in a normally menstruating lady, which is around 5 to 10, goes to 50, 60, 70 or 80.
Oh my goodness.
And when this flash comes, it stimulates the temperature regulation system, and so in spite of the fact that it is cold, the lady starts sweating. So the system goes haywire, but it's for a short period of time. It can of course be controlled by giving hormonal stimulation.
Right.
When it is very bad, then we put them on estrogen progesterone treatment for a short period of time to tide over the crisis.
Right.
That's called HRT. Of course, that's another topic in itself.
Yes.
But giving
yes.
hormone replacement therapy in such ladies completely takes care of the crisis, and it can go on for about a year, 2 years, or even longer, till she gradually settles into a non-hot flash stage, and then it can be withdrawn. And during this time, she should continuously go through checkups of her pap smear and a breast to rule out any breast malignancy.
Okay, so you spoke about pap smear. When is the time that I should take my first pap smear?
If you had a baby,
Yeah.
then you, after the first birthday of the baby, you do like every year for 3 years. And if everything is fine, then every 3 years. But make sure that your gynecologist examines you properly to make sure that there is no cervical lesion, and a pap smear is collected very carefully. And if it is a carefully collected pap smear and the cytologist gives you a clear, nothing to worry, keep it on every 3 years.
And what about a breast examination, a mammogram, to get a mammogram done?
Everyone should learn what is called as self-breast examination.
Right.
Using the flat of the hand, right hand for the left breast and left hand for the right breast, you should palpate and see whether there is any lump felt. If you use the fingers, the breast glands will feel like lumps. That is not the way.
Yes.
That is not the way. When the flat of the hand, you will feel a soft breast and no lump will be felt. If with the flat of the hand the lump is felt, that is when you understand there is a lump, and one has to be aware and should take it very seriously and approach a surgeon who will handle it carefully by doing all the investigations, including a biopsy if required, if there is a lump. If your flat of the hand is not showing anything, it's a good idea to visit a surgeon every 3 years and get yourself examined. And
A surgeon?
A surgeon who deals with breast diseases. Gynecologists also deal with it.
Yes.
But preferably somebody who will deal with breast malignancies, so as to be safe that you understand that there is no problem existing. A mammogram done every 3 years is also very useful. If there is no need to expose the lady to X-ray mammograms, a good sonologist can do a sonomammogram, with which you don't need to have the breast compressed between the plates as it is done for the X-ray mammogram, which is a little painful and harsh.
No, doctor, it is not little painful. It is extremely painful.
So to avoid that, I
it
know
is
what you're saying.
extremely painful. I've done
Yes.
it about 2-3 times.
Yes, so you can do a sonomammogram,
And
and that
it's
can also give a very good idea. And so if there is something on the sonomammogram, then of course go to a mammogram and get a proper opinion.
I think all the women who are listening, I think this is something really very, very important, excuse me, which he spoke about, doing the sonomammogram, if I'm not mistaken, which is not painful compared to the other one, which is,
Very
oh my
good.
goodness, it's really, I was screaming. I was actually screaming when I did that. But then getting back to it, so you're saying do a pap smear every 3 years. If it's the first baby, after the first birthday of the baby, you do the first pap smear, and then every 3 years. Am I right?
Perfect.
And the breast examination every 3 years as well?
As well.
And you recommend that the woman has to go to a
To a
surgeon
gynecologist or a surgeon, or the gynecologist, if he finds that something wrong, then he can refer you to the surgeon.
Okay. We have, we have done so much, and we have done it so fast. You also spoke about fibroids. Now, we all speak about it very loosely, in the sense that we say, yeah, I have a fibroid. My doctor said I have a fibroid. But what exactly is a fibroid? Is it like a ball or something like that? And what, can you explain?
Yeah, a fibroid is a tumor of the uterine muscle. Now, tumors are of two types, cancerous and non-cancerous. Fibroid is a non-cancerous tumor.
Okay.
And it appears in almost 30 to 40% of the ladies at some time in their life, generally starting around, say, 35 years onwards, till menopause. Most of the times, the fibroids are few and are asymptomatic. They are outside the uterus, in the sense, outside the myometrium. When they are in the uterine wall, which is close to the peritoneum, they are called subserosal fibroids. These fibroids, ranging from 2 to 6-7 centimeters, are asymptomatic, do not cause any problems, and do not need surgical intervention.
Okay.
The other fibroid is one which is in the wall of the uterus, which is called intramural fibroid. Even this fibroid, if it is not pressing on the cavity and is not producing excessive bleeding and or pain, then the size of it from 2 to 5 centimeters may be asymptomatic and does not have to be dealt with surgically at all.
So you can take medication and
Or leave it alone. If there is no
but
bleeding.
if it's hurting?
If it is hurting, then you need to take action. I'll come to that.
Right.
If it's a submucosal fibroid, that means fibroid which is extending into the cavity from where the menses is happening,
Yeah.
this is likely to get far more symptomatic with pain and excessive bleeding, and their action has to be taken. However, any fibroid situated anywhere can also cause excessive bleeding and pain, and when a symptomatic fibroid is there, it has to be dealt with. Lastly, if you do not have children and you have fibroids and they are symptomatic, then they would have to be dealt with. So these are the approaches to the fibroid, and one has to deal with it either surgically or with drugs, depending on the choice of the patient, the situation in where it is, and the gynec's expertise in dealing with it.
True. So you said that it could be done, it could be handled surgically, or it could be handled with medication. Now, a few years ago, I may be wrong, do correct me, but a few years ago, if you went to a gynec and you said, you know, they told you they have fibroids, invariably it was a surgery has to be done and it has to be removed. Today, there are medicines, medication can be taken whereby you do not have to go. Am I right? Is that
Yes. See, if it is a symptomatic fibroid and if it is very large, then it has to go through surgery.
Okay.
There is no much choice. If it's a small sized fibroid and it can be dealt with tablets, now there are many medications which are available, which can be given over a period of time, 3 to 6 months, during which the fibroid will shrink. The periods will also stop in that time because it is a hormonal suppression which happens due to with these tablets.
Okay.
There are very many tablets which are available for this, and it can be dealt with medically. However, if after stopping the medication the fibroid comes back with a vengeance and or the symptoms become worse, then of course surgery is involved. But each fibroid case should be dealt with by her gynecologist carefully and depending on the symptoms and the location.
Okay. You spoke about like some of the cancers like ovarian and breast cancers. Now, ovarian cancers are on the rise. We all know of so many women who have it, who have suffered because of it. What are symptoms, and what is the age that a woman should be looking out for symptoms and saying, this is something I need to pay attention to? So what are the symptoms that we should be looking at?
Unfortunately, an ovarian cancer does not necessarily produce any symptoms at all, and so even to date we find ovarian cancer patients coming to us in the last stage when the abdomen is distended and the ovarian cancer has spread to different parts of the body, because there is no pain involved. And if there is some discomfort, most ladies, especially the shy ones, will say, oh, hopefully it will go off, or they will take some digestive medicines and there is a little distension of the abdomen, so they think they put on fat, and the actual diagnosis gets missed. For a very conscious person, if a 3-yearly checkup is done by a gynecologist and a sonography, some ovarian cancers will be detected very early. However, if there is a symptomatic change which the lady finds, she should get herself thoroughly investigated with a gynecologist, do a proper ultrasound, tumor markers are there, and if necessary an MRI or a CT scan to detect if there is anything. So ovarian cancers do get detected very early too, but very few. Believe me, out of 100 ovarian cancers, only 30 will get detected early. The remaining 40 to 50 will get detected in a moderate stage, and almost 30% will be detected only in the last stage. So that's the dilemma of ovarian cancer.
So basically what you are saying is every 3 years women should go for these tests.
Detailed checkup.
The breast as well as the uterus.
And the pap smear.
And the pap smear.
Best.
So pap smear tells us
yes.
if there is some sort
cervical
of cancer.
Sonography will tell us if there is any uterine problem or the ovarian problem. The mammogram will tell us if there is anything related to the breast.
So I'm just asking, okay, can a woman go to a sonologist and say, I just want to do a test, or do we have to go through a gynec?
Have you heard of Dr. Google? Yes, yeah.
Yes,
yeah,
I
I'm nothing
have.
against Google, and we
I
also
know.
Google all the time. But
Yes.
now at least
No, but I do
the
use
thing-
Google, just so that everyone
Yes.
is watching. I do use Google a lot.
Yes,
but
so
yes.
a lot of women will already have made their diagnosis, and they will go to a sonologist directly and get a scan done, and then come to us with a report which says that, okay, this is what I have. However, it is best to go through a proper channel, because you know what sonography you want to do, what tests you want to do, and so meet your gynecologist, get a confirmation that you really need a sonography, and if you don't do it, it's a waste of time. And if you need it, then get the correct type of scan done.
Right, right. You said that some of the ovarian cancers, there is a swelling in the stomach. Is that what you're
Yes,
saying?
the abdomen distance, because there is fluid which is gathering called ascites. Ascites can be, of course, due to various medical and malignant reasons, but one of the symptoms is that the abdomen gets distended and the lady feels dyspepsia. By then, her ovarian cancer is already pretty large.
Nothing else to
Pinpointedly feel that there is no
even
pain.
slight, even small markers that I need to look at.
It's very difficult to pinpoint. There can be vague pains, or there may be a change in the menstruation, but pinpointedly ovarian cancer giving rise to symptoms which one should be aware of so that we detect early are very few.
Is there any age that that the cancer occurs between this age and this age? Is there
Most
anything of
ovarian
that?
cancers are detected after the age of 45 and 50, or I would say in the range of 60, 70 and 80 years. Ovarian cancers are not detected very early. Cervical and breast cancers are seen in a younger age group. Ovarian cancers, very few will occur after less than 40 years.
So you're saying ovarian is between 50 and 80?
Yes, most of them. It can occur early, of course. I mean, we have had ovarian cancer in girls as less as 17 and 18, but they are very rare.
Are there any particular causes for ovarian cancer? Is there anything, again, like
There are
menstrual cycle? Is there anything that we are doing or not doing that is causing
There is
this?
no, like for instance, a misuse of hormones may result in an endometrial cancer or a breast cancer, but there is no such medication or drug which is used which can result in ovarian cancer, though smoking and tobacco can cause cancer anywhere, and the incidence is high with ovarian cancers as well. One should always remember that ovarian cancer is not caused by a given cause, but there may be some genetically linked areas wherein certain genes and markers are there which indicate that so and so lady is more prone to an ovarian cancer than the general population. So there are various biomarkers which can be of use, but they are not used routinely to do screening to find out if somebody has a malignancy.
I just remember this one question I thought I was going to ask you earlier, but I've completely forgotten, but I need to ask him this. What got you interested in obstetrics? Why not some other field? What was it besides babies and
So I was going through my MBBS course, and I was posted in various departments. So when I was posted in the hospital in Raibandar Hospital, where the main gynec department was at Goa Medical College.
That was how many years ago, doctor?
It was exactly 1976, 77, 78. So when I was doing my clinical terms, I joined MBBS in 75, and then the first MBBS was in Bambolim, where we studied the anatomy, physiology, biochemistry, and then we were posted in medical college here, at where the Inox is now, and the gynec department was in Raibandar Hospital, where we were posted as students.
Right.
And one fine middle of the night, I was attending, and Dr. Noreen was there, and she said, "Why don't you conduct this delivery?" So I conducted the delivery. That was in 1978, and it was very exciting to see some girl coming out of the mother and then shouting and screaming. It frightened me too.
Of course.
And of course, we are not used to something like that, but it was a very nice experience, and I loved it. And so I decided I will go through as an obstetrician and gynecologist. Also, the same year, the Louise Brown was born, 78.
Oh, okay.
So I told me if it is possible someday, because
so that was that your dream, that this is.
I will also do IVF.
I will
someday.
also do IVF. So where did you go to do your learn? It's a specialization.
Yeah.
So where did you go to?
So we finished with our MBBS in Goa Medical College, and I did MD, though Goa Medical College, but answered in Bombay because those days it was the Bombay University.
Right.
So I answered in Sion Hospital, and next to KEM was the CPS, where I did my DGO. Then I did some initial training with Dr. Indira Hinduja in Bombay.
She was the first
IVF
doctor
in India.
Yes.
And then to get further knowledge, I did a diploma in Australia at the Sydney IVF. Dr. Rosemary Cullinan was my coach there, and she really put the enthusiasm in me to go ahead and do it in Goa. And eventually, after some years, she actually came here to our lab. So that was so thrilling.
Right. You have, I am just reading back again what, the points. You have delivered so far 300 IVF
No,
babies.
now it has crossed 2,000 almost, I think so. Yeah. This biodata was long time
This
back.
biodata has been given by doctor. It's not my fault.
No,
So
not your fault. Yeah. It was, you
viewers
just
must
said,
be
give me
thinking.
something, so I picked out from somewhere
So
maybe many years back.
2,000 babies, 2,000
Overall, we have
IVF.
crossed now maybe 7,000-8,000 babies that we have delivered, but pregnancies that have happened after our treatment has crossed maybe 17,000-18,000 in the last 30 years plus, I'm saying.
Dr. IVF.
Not all patients who have conceived deliver with us.
Yes.
Just understand that somebody is married for 10 years, is not pregnant, and she has come to us from, say, Margao, and we do the IVF and she's pregnant, and she goes back to deliver in Margao.
Okay.
So which is fine. So that those babies don't get delivered by us.
Okay. So
But the conception is with us.
when women come to you for IVF, is there a maximum age that beyond this age it's not possible because your biological clock, has stopped or whatever? Is there something like this that you can't do IVF, you can't have, you can't conceive through IVF because of your age? Is there a particular age?
There's a saying, never say never. Because when you say
That's a
no,
James
you will
Bond movie, by the way.
So if I say you will never conceive and this is not the right thing to do, some other lab or some other specialist can of course treat her and she can conceive. IVF has its own constraints. IVF has a success rate of maybe 30 or 40% per cycle. So everybody who thinks that I've done IVF is going to get a baby is not true. IVF can be done multiple times. Now of course when we do IVF, we take the eggs, take the sperms and make blastocysts, and they can be frozen.
Okay.
So if you have got like 5 or 6 eggs and you've got 5 or 6 embryos and you transfer and the person fails, you can use the frozen ones and then they conceive. They don't have to go through the entire cycle. So the cumulative success rate has now gone up to 50 or 60% for one cycle.
From 30%.
Yes. More than that may be happening in better clinics, but this is more or less the limitation. Now since you asked the age, up to the age of 40 we are very keen because she is young and her receptivity is good and implantation happens. Beyond that, her success rate falls to almost 10 to 15 or 20%. So you need to counsel her. Socioeconomically, she should be able to afford it.
Because it's very expensive,
Yes,
right?
and 2, she should understand that she should learn to take the failure more than success. Because after all the effort, if it does not happen, it is very heartbreaking. And the doctor himself has to be counseling himself because it's very heartbreaking for us also that we have tried so hard and it has not happened. So these are the limitations about age factors. But I think the oldest one whom we have delivered is more than 50 years.
Okay.
A lady from Raya, and more than 400 now above the age of 45 who have delivered.
You have in your clinic
in our hospital.
more than 400.
Yes. Now the issue here is one very important factor, and that is they may not form their own eggs, and the husband's sperms can be very good.
Yes.
In which case, a donor egg with a husband's sperm produces a very good embryo, and then she can have a baby, which is much better than adoption because it's a process which is a long one, and adoption process does not always give you a biological baby which is your own. So here at least the genetic father is there, and so a donor egg is used. Now this is very commonly used across the globe for people who do not have their own eggs and or have gone through menopause. So maybe we have delivered more than 100 menopausal ladies also in the last 10 years.
Okay, so women are open in Goa to
very, very common.
To having that. And you said that you use donor eggs. So do you have a bank over here
Yes.
where women can?
Yes.
I mean,
so this is a very good question. See, now supposing a lady has a malignancy and she has to go through a chemotherapy and she's young. Once chemotherapy is given, her eggs are over.
Yes.
So before they start, like we had a girl, 28-year-old, and had a Hodgkin's lymphoma, and she was just married. So if she goes through the chemotherapy, then her eggs will get depleted. So before the chemotherapy was started, she took a 3 weeks break. We did a stimulation, we retrieved almost 12 eggs and we have frozen them. Now once she takes her chemotherapy and she is cured of the Hodgkin's lymphoma, she comes back. Although her ovaries stop functioning, we have her eggs.
yes.
And we use her husband's sperms and make the baby and put into her, and she gets her own baby. Similar things are being done at our hospital for males. We have sperms from maybe more than 25 boys who have gone through similar treatment like testicular cancers or other cancers leukemias or lymphomas. Before starting the chemo, they give us the sperm samples and we put them in 4 vials. These are stored in cryopreservative units at minus 196 degrees centigrade in cryocans. And so we probably have more than 20 cryocans in our hospital in a huge cryo lab. And this can be frozen for years together.
Right.
So, and whenever they are cured, they come back and then they claim they are.
Right.
Yeah.
You know, we hear about these things only in science fiction stories and movies. So to actually hear it coming from you, it's amazing.
Thank you.
It's amazing. So I
Also now the career is a factor. A lot of ladies think that getting married at 26 and 27 is bad and it affects their careers, especially those who are involved in entertainment programs, actors and actresses who want to complete their career, which happens at around 35 or 40.
Yes.
Before that, if they have babies, then the career is interrupted. So they come down and they get stimulated. We take their oocytes and freeze them, and then they go through the career, and at the age of 35 or 40, when they do get married, they have their oocytes which are younger.
now
Trends are changing in modern
yeah,
times.
it is. I mean, like I said, you know, he spoke about the eggs and the sperm being frozen, and I'm thinking, gosh, which movie did I see that something like that was done? But one important question, I mean, you spoke about donors, you know, donating egg and sperm. So can anyone who would like to donate come to your clinic and donate, or there is a protocol? And
There is a protocol. We don't take anyone who wants to just donate, nor is there any commercial donation at our place. But there are voluntary donors who would want to donate. Most of the times, let us give you a classic example of a girl who got married to her boss. And so her age was only 24 and the boss was 55. And so his sperm count was very poor, and we stimulated her for IVF. So when we stimulated her for IVF, we got like about 15 eggs. And so we got about 6 embryos, and she already has twin babies. 4 of her embryos are frozen with us. The remaining eggs, which are say almost 10 plus eggs, she will not be needing because the husband is very sure that he will never want further.
another child.
Now these oocytes she is ready to donate. So this is how we have a donor who will come. She has to give a consent that this is an anonymous donation. And
But
Yes.
what is the protocol? I mean, I think it's a very good thing to, you know,
yes,
donate
I mean,
your
there are
sperm
IVF
and
centers
eggs.
across the globe.
You all don't have it in your clinic.
We don't have any commercial donation
No, not
program.
commercial. I'm just saying
No,
I
there are
want
girls who
to.
come and donate. Oh yes, yes. There may be a lady who says, "I want to just donate."
I
my
just
eggs."
want to donate. I don't want anything from you.
Yes.
Just knowing that I could help.
Yes.
I'm sure there are women out there and men out there as well,
Yeah.
you know, who would like to do a service to society, to people who do not have children. And I think this is a fantastic way of
Yes.
doing it, doctor. So I just want to donate. I don't need money. I don't need nothing. I just want to donate. So can I come to your clinic and can I
I have
donate?
not started any such protocols
No.
as yet. No,
Is there anything in Goa that we can
I
go?
wouldn't know. I don't think so. Yeah.
No.
Yeah. But in most metropolitan cities.
Okay,
yes.
so Mumbai, Bangalore, things like that I can go to. That's interesting.
So one
Very-
important point we should talk about before we wind up, and that is polycystic ovarian disease.
Yes, I am going to get to. We have about just 10 minutes, and so you are speaking fast. He's speaking really fast, and my questions are also coming out fast. But there are many more questions that I need to ask. Yes.
So there is an epidemic of a syndrome called polycystic ovarian syndrome, and you will notice that young girls are putting on weight, and their periods don't come on time, and they start developing a lot of acne as well as hair growth.
Right.
And the hair growth is called hirsutism. Not all girls with polycystic ovaries get hirsutism, but definitely they tend to put on weight and their periods go haywire and they don't menstruate. So they start menstruating at the age of 11, 12, 13, then they start putting on weight. The period starts getting delayed, and then it doesn't come for 2 months, 3 months or 4 months. When it comes, it's very painful and it lasts for a long time. At that point of time, they also start developing a lot of acne, and some of them will develop hair growth. Now this is a syndrome which has come up in such a big way that from 1977-78, when I did my MBBS, when the polycystic ovarian syndrome was called Stein-Leventhal syndrome, was present in 1 to 2% of the girls, is now gone to 30%. It's like an epidemic.
Wow.
So 3 out of 7 girls of the age of 14 to 18 now have symptoms of some way related to polycystic ovaries.
And that is again due to lifestyle,
Yes,
food,
diet, food,
you know,
anxiety, stress.
anxiety and stress. That
So
too.
if you were asking me a question, when should a girl approach if she's putting on weight if she's periods are going delayed, if she's developing hair growth, if her acne is not settling down, that is the time when she should approach a gynecologist early and get herself
You know, the
investigated.
putting on weight, doctor, is obesity is on the rise everywhere.
Yes,
Today, if you look around,
absolutely.
you know, obesity is on the rise, and parents normally think that my child is so cute, so chubby, and so lovely, and they don't realize that, you know, it is reaching danger levels.
Yes,
And especially when girls become all chubby, they start developing so fast. Their breasts start growing, and I've seen young girls like 6 and 7 who can already see, you know, have breasts. You can see their breasts developing, and it's a little shocking. I mean, you think about it and you say, oh my goodness, yes. So PCOS and PCOD are
Yeah, it's the
things
same thing, yeah.
that can be with medication, and of course a change in lifestyle that can change. We've had, doctor, a very brave young lady who has very severe hirsutism, Sabrina by name. I hope Sabrina is watching, and would love to say we acknowledge how brave you have been, who came out and did a workshop for us for the Navin Times, where she grew her beard and her mustache. She says, I want people to see what it is, you know, and she was so open to it. And she says she's going through a lot of medication and injections, but she says it's not been helping her. And she spoke at length. It was about 45 minutes or so, where she spoke about, you know, her story. She did not speak about generally, and she spoke about, you know, how difficult it is. And she speaks about the trauma that she had to go through. And she says, I still go. I have to shave, or I have to wax. Sometimes she had to wax every day.
yes, yes.
She says it was
I
painful.
had many patients who have had to do that because the testosterone receptors become very sensitive and they start developing the hair, and they want to go out anywhere. They first have to shave and then they go out.
Yes.
And then the only way to handle it more carefully is to do electrolysis, which is very
Which
painful.
is so painful.
And very expensive, and you have to go centimeter by centimeter by the time you get rid of the hair, which is also very traumatic.
Right. Just a few questions. We have about like 5 to 7 minutes to go, and now normally that's the normal you know, impression we have. Maybe it is a misconception, I don't know, I'm going to ask doctor, but we always believe that if you are on birth control pills, you tend to put on weight. Is that true?
Partly true, because it can increase your appetite, the birth control pills, and if you tend to succumb to that, then you will put on weight. However, if you are aware of this fact that your appetite can change, also it can cause certain amount of water retention in the body, which also adds to the increase in the weight. So the best thing to do is request your gynecologist to give you the minimum dose pill. It's called mini pill, so that the estrogen content in the pill is very low, so the side effects are very low. However, it does produce an increase in appetite, and if the girl succumbs to that appetite, then she's going to put on weight. But if she's aware of it, she keeps exercising, drinks a lot of water, lot of raw foods, fruit and vegetables, and does not take up a lot of fried food, sweets, it's likely that she'll maintain her weight, which happens in almost 50% of the people who are taking OC pills. But the other 50% tend to put on weight because they succumb to the increasing appetite and the side effects which the OC pills give.
Now you said mini pill, am I right? If it is a mini pill, is it still as potent as the regular one, or are the chances of getting pregnant compromised, you know?
Yeah. Okay, it's a good question. So earlier,
just a moment, I have asked you many good questions, right?
Yes.
Just so that the audience know.
Yes.
I've asked you many good questions.
Yes, absolutely. Absolutely.
I was just kidding, doctor. Yes, please go ahead.
So earlier in my college days, the pill would contain 50 micrograms of ethanyl estradiol, which is the potent drug. It is also very harmful. But by the time I finished my MD and started practice, it had come down to 30 micrograms of ethanyl estradiol with progesterone, which is a very good pill to take. However, the scientists advocated use of less and less amount of ethanyl estradiol, and now there are pills which are up to 15 or 20 micrograms, which is really
amazing.
Very less estrogen, and it still has the same potency.
Oh, it does?
Yeah, only side effect is that because the estrogen is less, during this 21 days period, there should be no bleeding, and after you finish, the bleeding happens after 3 to 4 days. With the mini pills, there can be breakthrough bleeding. That means she might bleed on the 15th day or 17th day, which is a little disturbing, but you should continue with the pill throughout, and then the regular menses happens. it also means that the mini pill is not suiting, and instead of 15 micrograms, you move on to the one which has 20 or 30, and that takes care of that. So the reason why that's a good question is because it reduces the intake of estrogen levels significantly, which means the side effects will be very less.
And the weight gain will be less. So if women you are thinking about taking these pills, you need to speak with your doctor and find out. And if you said on the 15th day or the 17th day there would be some bleeding, how long does that continue? A month,
Generally,
2 months?
No. Let's say that when you use a oral contraceptive pill, you start on the 5th day of the period. So the first day she got her period, second, third, fourth day, 5th day she starts the period, the pill, which is taken for 21 days. And after she stops, after 3 to 4 days, she gets a period. So it's a 28-day cycle.
Okay.
If it's on the continuous pill, then on the 5th day, she starts the pills again. So let's say that she started a pill on the 5th day, and on 15th day, she bled. She should continue to take the pill. And when she finishes on the 21st day, she will get her regular periods. That's how it is. It's not that it continues.
So only in that first month?
Yeah. No, not first month. It can happen in any month. But if it happens and it continues as a period, that means there is breakthrough bleeding which has continued into a menstruation, the pills should be stopped and restarted with a new fresh packet of pills.
So are today pills becoming more potent with as far as birth control pills are there? Are they becoming more potent and less side effects, more potency?
Potency is not increased. Because of the low level of estrogen used, the side effects are lesser.
Okay, right. Now, I spoke about the grandma approach and all the things that we say. Now, tell me, in India, especially in Goa, there are lots of people using grandma remedies and not going to a gynec, and this is causing a problem. Is it happening in Goa?
Not in my practice, Maria. I feel our population is very educated. They approach their family doctor, and of course they might try out some grandma remedies for a while, but they generally ask their family doctors. Most of the families have doctors in their families, so they recommend. Most of the young girls are now very well versed with internet.
Dr. Google?
Yes, so they will look at it, and so remedies come, and they plan their
They are not hesitant to come to a gynec and
yes.
meet up with the gynec, and
Absolutely.
because some families the women are not allowed,
True.
the mother-in-law will come with you, or the mother
Yes.
comes and you only go with her and nobody else.
Yes.
Now, my last question to you is just a few minutes. My last question to you, doctor, is that you are an IVF specialist. It is expensive. It is an expensive, and you also spoke that you need counseling. People who go in for IVF need to be counseled. I seen just a few weeks ago, I was looking through and was doing a little research about you, and I saw that there was this young boy from Dubai who became the first single father. First single father. You normally hear of women, having IVF babies. So, can men and women do that in India, or that you can?
The law as of now does not prevent them. They have to be Indian citizens, and they are allowed to have a baby of their own choice. So that is possible in India, and so that is how Yusuf became the
Yusuf.
father of
That's right.
boy. Talking about expenses in IVF treatment. So if you go to the metropolitan cities, the IVF treatment costs anywhere between 1 to 4 lakhs, 5 lakhs for a 1 month, one single treatment cycle.
And there can be multiple cycles.
Yes. Then there is cryopreservation, embryo transfer expenses, and what have you. We have put in quite a bit of limitation, including the drug costs. So, a center can project the cost as drug cost and IVF cost. So then the drug cost is say about 50, 60, 70,000 rupees, then IVF cost is only 40,000. So this is how a patient can be misled. The patient is paying from her pocket, whether it is medicines or for the IVF treatment, and therefore it should be understood that the drugs plus the actual treatment will cost close to a 1 lakh package for a given cycle. However, this is happening because the drugs cost are very expensive. The drugs which are used for IVF cost anywhere between 1000 to 2000 rupees per injection, and sometimes the patient requires 2-3 injections per day. And so the
Oh my
costs go up to
goodness.
50, 60, 70, 80, 90,000 rupees depending on what the doctor chooses to give. It's up to the government to make sure that they can do something about this and bring down the costs of IVF. And if the IVF gets done for 30, 40 or 50,000 rupees, I'm sure it is not very financially traumatic. More cycles can be done, more successes can happen. And I think it is purely possible. But like the one which we use called Gonalef comes to us from Italy. It is manufactured by Cirono, and the cost of the drug is 5,000 rupees each. And if you decide to use 10 or 15 of these, then she's going to land up paying for just the medicine 70,000 rupees, plus there are media involved, the embryo transfer medium, the cleavage medium, the cryoprotective media, which are also expensive. So the medicine cost itself goes to a huge amount. And if for some reason and somehow government intervenes and brings down the cost of these medications, IVF will become much more economical. And I think government should think positively in this direction to make sure that those companies and the government have some understanding that these people suffer for childlessness, and it's a very, very traumatic situation. And if they can do something about bringing down the cost of the medication, the cost of IVF will come down drastically, and a lot of couples across the globe will be helped.
You don't think that it's better for them to adopt with our population the way it's booming?
It is the need of the woman to have a baby. It is the cry of the womb. Adoption does not fulfill her motherhood. And so a lady will go to any extent. If you come to my clinic anytime, I don't know if you see patients waiting till 1 o'clock in the night, 3-4 hours at a stretch to just have this baby. And so that feel is that feel, and it should be fulfilled. Why not? And just because the drugs are expensive, it should not be. So on behalf of One World, we actually sponsor, and almost 30% IVFs in my hospital happen free of cost.
So let me get this right. You said in the metropolitan cities, IVF costs anywhere around 4 lakhs. What about in Goa, at your clinic?
About 1 lakh.
For one cycle?
Government of Goa is doing a good job. For the tribal people, they would have made it free. So they pay, they send them to us, and we give them the entire treatment for IVF, no matter what it costs, for 1 lakh rupees, even if it is 1.5 lakh expense. The government pays us 1 lakh rupees for that, and for the patient it is 0 cost.
That's amazing. You are doing some amazing work, doctor.
Thank you so much.
And this interview was amazing because I have learnt a lot, and I'm sure you have. We would love to hear from you. Do give us your feedback, and thank you for watching. Doctor, thank you so much for coming on our show.
Thank you, audience, and thank you, Goa, for giving me this opportunity, and the Navin Times.
And we are blessed to have a doctor like this in our state, and we are actually very, very proud of you, doctor. So thank you for joining us once again. Till next time, take care of yourself. Bye for now.
God bless. Thank you so much.
Thanks.
Bye-bye.